Essential actions for head injury emergencies. Imagine you're out enjoying a day with friends or family when suddenly, someone trips and injures their head. It's a scary situation, and knowing what to do in an emergency can make all the difference. Before we go further, remember to subscribe to our channel by hitting the subscribe button below, give it a thumbs up, and share it with your friends or on your social media platforms. Now, let's dive back into the video. Signs of a serious head injury. Be alert to signs of a serious head injury. Some red flags to watch for include 1. A loss of consciousness, which might indicate a concussion or more serious brain injury. 2. A severe headache that gets worse over time could be a sign of internal bleeding or increased pressure in the brain. 3. Repeated vomiting is another major warning sign. 4. If you notice clear fluid draining from the nose or ears, this could point to a skull fracture and leaking cerebrospinal fluid. If you spot any of these symptoms, acting quickly is crucial. Recognizing these signs early and responding quickly can significantly impact the person's recovery. Here are the steps you can take if you suspect a serious head injury. Step 1. Assess the situation. When a head injury happens, the very first thing you should do is assess the situation. Check if the person is conscious. If not, make sure they're breathing and have a pulse. If they're conscious, ask simple questions to gauge their awareness. With these questions, you're looking for signs like confusion, dizziness, or visible bleeding. These can be an early indicator of head trauma. Be on the lookout for bruising, swelling, or any fluid leaking from the nose or ears. It sounds grim, but being thorough here can help the person get the right care. Step 2. Call for emergency help. Next, don't hesitate and call for emergency services right away. Be clear and precise when you get on the phone. Let the dispatcher know it's a head injury, describe the person's consciousness level, and mention any symptoms you notice. Tell them exactly where you are and how the injury occurred. This information helps the emergency responders prepare for what they're dealing with before they even arrive. Step 3. Stabilize the head and neck. Keeping the head and neck stable can prevent further injury until professionals arrive. Stabilize the person's head and neck. Think of it like holding a delicate vase. You don't want it to move or tip over. If you suspect a spinal injury, keeping the person still is critical. Tell them not to move, and if they're lying down, gently place your hands on either side of their head to keep it aligned with their spine. If you've got towels or clothes nearby, you can roll them up and place them on either side of the head for extra support. But remember, don't move the person unless absolutely necessary, such as if there's an immediate danger. Step 4. Control bleeding. If there's any bleeding, you've got to control it. Use a clean cloth or bandage and apply gentle pressure to the wound. If you don't have a clean cloth, anything absorbent will do in a pinch. Be careful not to press too hard, as it might make the injury worse. And while you're at it, try to keep things as sterile as possible. Wash your hands first or use gloves if you can. If the blood soaks through the cloth, don't remove it. Just add more layers on top. Controlling the bleeding is crucial not only to prevent infection, but also to prevent the situation from getting worse before help arrives. Step 5. Monitor vital signs. Keep an eye on the person's vital signs. This means regularly checking their breathing, pulse, and how responsive they are. Look for the rise and fall of their chest and listen for any irregularities in their breathing. To check the pulse, feel their wrist or neck for a steady beat. Ask them simple questions or give gentle instructions to see if they're still responsive. If you notice any sudden changes, like if they become less responsive or their breathing changes, be ready to relay this information to emergency services when they arrive. Monitoring these signs can give medical professionals a better picture of the situation, allowing them to act more effectively. Step 6. Avoid giving food or drink. One crucial thing to remember: avoid giving the injured person any food or drink. This is really important, especially if they're feeling nauseous or have been vomiting, which can happen after a head injury. Offering food or drink could increase the risk of choking or aspiration, where something gets into the lungs instead of the stomach. Plus, If they need surgery or other medical procedures, having food or drink in their system could complicate things. So, hold off on food and drink until a doctor gives the all clear. Step 7. Provide comfort and reassurance. Lastly, provide comfort and reassurance. Stay calm and composed. It helps the injured person stay calm as well. Talk to them in a gentle, soothing voice, letting them know that help is on the way and that they're not alone. Keep them still and comfortable. Cover them with a blanket to keep them warm and continue to speak softly. Your calm presence can make a huge difference in helping them stay relaxed until medical help arrives. Being prepared to handle a head injury isn't just about knowing what to do. It's about staying calm, acting quickly, and giving the injured person the best chance for a full recovery. Remember, the steps you take in those critical moments can make all the difference in saving someone's life. So, stay informed, stay calm, and you'll be ready to help when it's most needed. If you like this video, please press the subscribe button for more health-related advice and insights, give it a thumbs up, and share it with your friends and family. We appreciate your time, and we'll see you next time. Be healthy and keep flourishing.